Okay, Mark. The final item for today is to begin to look at setting some goals for treatment. And so I'd like just to spend some time just looking at what you'd hope to achieve at the end of our sessions together.
Mm-hmm.
Have you got anything in mind now, just as we talk about this?
Well, I just don't really want the reason why I'm here is I just don't want panic anymore.
Yeah,
it's like it's really uncomfortable, and I just don't want to feel like that ever again, really.
Yeah, that's fair enough. Could we kind of try and quantify? Obviously, you want to reduce them, and I guess where I'm getting is a message that you want them to be zero. What would be a good sort of point to get to?
Well, I'm having like 3 or 4 a week at the moment,
Yeah.
so maybe if you get it down to about once a month or something.
Yeah, okay.
That might be like better than how many I'm getting at the moment. So
yeah, that would be a great reduction, wouldn't it? Okay, then. So we're going to try and get to one a month. Yeah.
Okay.
See if we can get to that. So rather than kind of going from every other day, which is obviously quite rather frequent, and going from that to zero, which is a big huge step, we're going to look at trying to get them down to 1 per month.
Yeah. Okay.
That'd be okay.
Yeah, that'd be much more like manageable.
Okay.
Like, I suppose I could live with that.
Yeah. And maybe, who knows, maybe you can get to that ideal goal, which would be zero. Are there any other targets or goals you'd like to?
Well, the only one I think of is that they come out of the blue, and I don't know where they come from.
Mm-hmm.
And when I do get them, it's like I don't know what my body's doing. I feel very much
Right.
I'm out of control and stuff, and I feel like I'm going crazy and things like that. So I don't really know what my body's trying to tell me. So.
Mm-hmm. Okay, then. So it sounds like there might be a couple of possible goals we could draw out of what you just said there. This idea that they seem to come out of the blue, makes them really scary when that happens, and they just seem to come from nowhere.
Mm-hmm.
I wonder if we could have a look at that and see whether that's totally accurate. Maybe there might be some triggers which we could identify to your panic attacks. I'm not sure whether there are or not at the moment, but could we look at that as a possibility to try and identify triggers?
Mm-hmm.
Yeah? Okay. And also you're saying that you really don't know what's going on, although it feels as if you're going crazy.
Mm-hmm.
Would it be useful in that case to maybe learn a little bit more about panic attacks and how they actually work, how panic attacks come on and how they build and so on. Yeah? So if we look at a target, something around, what would be the target there?
Well, when I feel like I'm panicking as well, it's like I don't know what my body's doing as well. So I have no idea what's going on. So I think maybe I could know a little bit more about what panic is.
So it's pretty confusing, pretty scary stuff,
Really
isn't it?
scary.
Yeah. All right then. So maybe just to spend some time talking about what panic attacks are, maybe just to understand a little bit more about how they work. So sort of learn a little bit more about panic attacks. Yeah. Would that be an okay goal to learn more about them? So we've got 3. Is there anything else?
And that kind of covers it, really.
Okay, so what we've got here is we want to look at ultimately reducing these panic attacks. That's the whole aim of this, is to reduce the panic attacks. We're going to go for hopefully a target which is achievable, which is get them down to 1 per month. Hopefully that's going to go further, and certainly we would want to try and get rid of these panic attacks in situations such as the lecture theatre and so on, because that's just not helpful at all, is it?
No.
So we're going to really go for that, and it sounds like these other 2 targets, these other 2 goals, understand a bit more about the triggers to your panic attacks, and actually just learning a bit more about panic attacks in general, and then specifically looking at yours. Those may help us to achieve that longer term goal.
Okay.
Is there anything else?
No, I think that covers it all, really.
Yeah. Okay, that sounds great. That sounds like a really good starting point for us.
Okay.
Yeah.